Hi, I'm Kate Gebbie. I'm the owner and a licensed professional counselor at Anchor Wellness. Like I just said, I'm a licensed professional counselor, LPC, in the state of Connecticut, and I'm also actually a registered provider, telehealth provider for Florida. So any Floridians that are watching, hi, from Connecticut, from up north. I just wanted to hop on and do a quick intro to give you a little bit of background on me, who I am, how I got into this field, and sort of just, what's the work that I do and what does that look like and how does that pertain to you. So I actually started my mental health work journey in 2008. I interned at the Partial Hospital Program at Yale, and what Partial Hospital Program means is that it's an outpatient program, but the kids that I was working with in that instance were attending every single day, and they were attending for a number of hours every day. So I did that, and when I was working with that population, I was also integrated quite a bit with the inpatient population. So when I graduated from Hamilton College in 2010 with a degree in psychology, I decided to pursue working on the inpatient unit there at Yale. So I got a job there as a milieu counselor. And for those who don't know what a milieu counselor is, that is a person who works directly with the patients that are on the unit. So you're doing their daily routines with them, you're helping them with coping skills, you're helping them work through some difficult stuff, you might be helping them with going to groups or attending groups and things like that. So we did a lot of just working day to day. It's really hard work. So those of you who have done that work and who do direct care, hats off to you. It's really, really hard work. I lasted for about 3 years there. And so while I was there, I actually decided to get my master's degree in psychology from Sacred Heart University. And, in grad school, I wasn't really sure like what kind of, psychology I wanted to get into, what sort of part of the field that I wanted to get into. So I started exploring different jobs for master's level clinicians out there, and I landed at Child and Family Agency out in New London, and there I worked in a couple of community-based programs. So the first one was ICAPS, which is Intensive In-Home Child and Adolescent Psychiatric Service, and that's quite a mouthful, but it's a program that is teamed. It's a master's level clinician usually and a bachelor's level mental health counselor, or in some cases another master's level clinician. And what you do is you go out into the home and you're seeing families and the identified client, which in this case would be a child or adolescent, intensively 2 to 3 times a week for a period of 6 months. And that program is really intended to do a lot of stabilizing in the community to help prevent hospitalization. So I did a lot of acute crisis work. I learned a lot of family work. I learned a lot of different diagnoses. ICAPS is a program where, and this is a program that's actually only located in Connecticut at this time, but it was developed by Yale. But it's a program that addresses a lot of different issues. So I learned a ton when I was working in that program. And then after that, I became a supervisor, and I supervised ICAPS, and then I supervised another program which was also in-home, also 6 months, also 2 to 3 times a week, called multidimensional family therapy. For those in Florida, you may have heard of this program. It's out of the University of Miami. It's actually an internationally used program, so it's used across the United States in several different states, including Connecticut, as well as some countries internationally. And that program is intended for adolescents who utilize substances. And what that program does really, really well that I learned a lot there was how to be a really strong family therapist, and really working relationally. So working within the relationship between child and parent, between parents, working with each other, and then, child and other individuals in their lives. So that program, I did a therapist certification, and then I did a supervisor certification. So I was certified in both and oversaw both of those programs at the same time. And so I stayed at Child and Family Agency, which is, for those out there, wonderful community-based agency. They have a lot of really great resources there. So if you're in that area and you're looking for some resources, reach out to Child and Family Agency. They have quite a bit going on. But I, was overseeing these programs, and I had stopped doing so much direct care work, directly working with clients. And in the middle of my supervisory sort of career there, we started an adult outpatient program. So I started working with adults and working with, different kinds, but I did end up working with some mothers. And these were all parents too. These were all parents of kids that were in our agency. And what I learned from that was that I really, really loved working with parents in their parenting capacity, and I loved working with moms, especially around the perinatal time. I had quite a few moms that were working with me to either help their older children adjust to a new baby, or just going through like, how do I adjust myself to having a new baby? So I did a lot of that work. And then I got myself trained through Postpartum Support International in doing some specialization work in perinatal mental health itself. So when I decided to leave Child and Family Agency, I carried that with me, and that was something that I felt I really wanted to pursue full time. What's it like to do therapy with me? Well, as you may have heard me say a couple of times when I was talking about my experience, I'm a very relational therapist. I'm somebody who really likes to work within relationships. And so whether you're working with me individually or you're working with me in a family capacity, I like to focus on that piece a lot. If you're coming to me with symptoms, or things that you're really concerned about, I probably am not going to stay on the surface level and say, how do we just alleviate that? I will do some of that work, but I'm also going to then get deeper and talk about what's driving those symptoms or what's making them happen, and how do we deal with that stuff. Because what I find is that creates the best long-term change. In my experience, that's what's worked for me. So I will do a lot of that work. I am a very direct person. I don't really like to beat around the bush. I'm very transparent. I will be very forthcoming, but also kind. Like, I'm not going to sit here and sort of be accusatory and tell you, you're doing something wrong. Or not. That's not what I mean by direct. What I mean by that is that if I see something that sort of sticks out to me, I'm going to point it out, and I'm going to point it out in a way that's sort of like, let's talk about this together. Let's think about this together, because I actually think that that's pretty important. So when we do that work, that's a lot of what you'll see me do, is sort of like, doing a lot of, let's look at the bigger picture and let's talk about that, because I think that's actually something that is driving this. And yeah, I mean, I'm also somebody who's uses a lot of humor and is sarcastic. Sometimes I try to curb that a little bit, but I do use quite a bit of humor. I'm a very just kind of light person, but I am also totally fine and okay with sitting in some really tough stuff. I've been doing this for a while, and I've really learned how to sit with some really difficult things, because I think when people come to therapy, what they want to do more than anything is be able to know how to tolerate some of that really difficult stuff they're going through. Like, I'm not going to be able to alleviate a lot of the stuff that's happening for you, but I can totally sit with you in it and help you figure out how to cope with it yourself. So I'll kind of bounce back and forth between those, and I have a little bit of both in me, and so hopefully you're okay with sarcasm. If you're not, it might not be a great match, but that's okay. 99% of therapy really is having a good match with your therapist, and so when you're sort of surfing through and looking for who might be the best match for you, you really want to think about, like, is that going to be okay for me if I'm sitting in a session and my therapist has like a kind of overt sense of humor, or do I want somebody a little more serious? So think about that. When you're looking for a therapist, I'd really encourage you to look for, what would I be most comfortable with? And secondary to that, what's their expertise? You definitely want both. So I would never take a client that I thought was not appropriate for my practice. When you call me or email me to schedule a consultation, I will kind of talk with you about, you know, what makes sense for you. And if I don't think that this is a good fit, or it doesn't seem like something that maybe you would get the most out of, I won't recommend you for treatment. Certainly if you are, and I do take a wide range of clients, I will encourage you to continue engaging. But if you're not someone that, you know, seems like they would fit, or you're having a really hard time and this is just kind of a reach out and I need to figure out what's going on, I will totally help you find the best match for you. Because ultimately you're putting all this time in, you're dedicating a ton of time, and in some cases a ton of money, and you really should get out, you know, what you're putting into this. So that's pretty much it. Visit my website, anchorwellnessllc.com. There you will find ways to contact me. My email's there, my phone number's there, and there's a little contact form if you just want to shoot a quick message as sort of an initial contact, and then I'll get back to you. I'm pretty quick about it, usually within 1 business day or so. So yeah, and if you have any other questions, or if you have any general questions that's maybe not about a consultation, please feel free to reach out, and I'll do my best to help you. All right, I hope to talk to you guys soon.